The systems approach to investigation is all about understanding the deep underlying reasons why a clinical incident occurred. It goes beyond who did what and when to understand why an adverse event occurred. There is a saying in patient safety that when something goes wrong, it's because the system was performing exactly as designed. This play on words is to say that the real causes of adverse events actually stem from the way in which we currently deliver care. Clinical incidents arise from gaps, vulnerabilities or flaws in the way in which we deliver care, be it our resourcing, our equipment, our policies, guidelines, training, or simply the performance variability that comes naturally from being human. The systems approach to incident investigation searches for these gaps and deficiencies in how we do our business and attempts to build stronger, more resilient systems of healthcare delivery. In short, the systems approach goes deeper than simply asking who did something wrong. The Swiss cheese model is a useful analogy for the systems approach to incident investigation. Developed by Professor James Reason, the Swiss cheese model suggests that the system of healthcare delivery is built somewhat like layers of Swiss cheese. Each slice of cheese represents a barrier put in place to stop clinical incidents occurring. From organisational processes and management decisions to the everyday work environment through to individual staff, each component of the system plays a role in patient safety. However, like a slice of Swiss cheese, none of these layers are perfect. They each have holes. Sometimes the holes in the Swiss cheese line up and an incident occurs. The task of incident investigation is to identify these holes in the Swiss cheese that contributed to an incident and suggest, through the recommendations we make, the ways in which we can plug those holes in the cheese. The systems approach asks us to step away from a simple person approach to investigation and to dig deeper into the underlying causes of an incident. This approach says it's not enough just to identify failings of individual staff, but rather we need to put errors and mistakes in a broader context. There are a number of tools we can use in an incident investigation to help us adopt a systems approach. The first of these tools is a simple checklist for contributory factors. This checklist prompts us to consider whether a component of the system, such as teamwork and communication or equipment design, may have played a role in the incident we are investigating. The second of these tools is the Ishikawa or fishbone diagram. This tool helps us to brainstorm why a certain problem occurred. Using the categories from the checklist we've just seen, we can dig deeper by continuing to understand why events that lead to an incident happened, leading us to understand the gaps or flaws in the current way we do business that become the targets for our recommendations from the investigation. In summary, the systems approach to investigation makes sure we are able to identify the real underlying causes of an incident, and it ensures that our targets for recommendations make meaningful change and improvement to the way in which we deliver care.